Transitional Care is a clinic that we offer. What we do is we see patients with chronic disorders for heart failure and also chronic lung disorders such as COPD. And we are in between both the provider and patient going home. So we see them in the middle. We just want to make sure that they're doing well and that they have all the resources that they need to have a high quality of life. So we work closely with the patient's healthcare provider, whether it be pulmonologist, cardiologist, primary care provider, and we collaborate closely with them to make sure they have all those resources.
When they come into the hospital with a diagnosis of heart failure, we see them on the floor. We do education, intensive education, to try to make sure they know what to do when they go home to take care of themselves. And that may involve things like getting them outside services too, like home care, palliative care, help with medications, help with insurance.
I see the patients, we see them usually shortly after they're discharged from the hospital and then every couple weeks thereafter. When they're discharged from the hospital, we like to go over their medicines, make sure, nothing got missed on the discharge process. And, these patients are seeing multiple providers to where making sure they're on all appropriate medicines that aren't, going to interact with each other or have any problems. I also like to sit down with the patients and explain to them why they're taking all of these medicines, because some of them are like, well, can't I just take one blood pressure pill? Why do I need 5? And so it's really about how we can empower the patients to help teach them to take care of themselves and make sure they know the why of why we're doing everything that we're doing for them.
The first thing we do is visit the patient and do what we call a nutrition history, so we can assess what habits are and what they usually eat at home and what's available to them at home and what their living conditions are like. Is somebody there to cook for them? Do they do their own shopping? Just where do they get their foods? And then from there, we just intervene to help teach them what heart-healthy eating is. And, if this is a normal food that you're used to having, do we need to make some changes to that, make alternate suggestions of things to focus in on for their food choices. It is a very big change because the main focus for a heart failure diet is sodium, and that changes the taste of the food dramatically, is a good word. A lot of people are resistant to that, but hopefully we can explain to them the whys and wherefores of why they're being tortured into a special diet. Yes, I think it does take time for their taste buds to readjust, and we always try to encourage that they just give the whole idea time, try to give them lots of seasoning ideas beyond using a sodium-based product. There's lots of herbs and lots of spices and things that we could do in an alternative way, and hope, try to encourage them to have an open mind about it.
Being able to build a relationship with my patients, getting to know them on a one-on-one basis, and that's just really what attracted me to this position, and providing patient education has always been my love and passion. So I love educating patients and having to see them, just getting to know them and sitting down and talking with them.